The number one cause of shoulder disability is rotator cuff tendon disease and tearing. The rotator cuff is a group of 4 muscles to tendons that surround the top part of the shoulder, and they allow us to lift the shoulder, elevate the shoulder, and it's something that we see injury in quite often. There's acute traumatic tears, and then there's degenerative tears. So a lot of what I do is very minimally invasive surgery, and I'm able to effect a really significant, strong repair using these arthroscopic techniques for the patient. And now the new frontier that we're looking at has to do with maximizing healing, so maximizing the biology of rotator cuff repair, and I incorporate that in with my surgical techniques. In particular, we're looking at injections that can help out after repair, including platelet injections. Especially here at Coordinated, we've developed an advanced program looking at both multimodal pain control to really allow the patient to go through the surgery with minimal pain, and that allows them to start working with our therapists much earlier, which can be very helpful as far as their recovery.